Functional Physio presents ePoster 2020. Associated by Mind Academy and Sportson.
Presenter Angel Bhagat. On the title Frozen Shoulder.
Hello everyone, this is Angel Bhagat from 3rd year BPT and I am going to present my e-poster on frozen shoulder in next few minutes. So what is frozen shoulder? It is also termed as periarthritis shoulder or adhesive capsulitis, meaning a condition where the glenohumeral joint becomes painful and stiff because of the loss of resilience of the joint capsule, possibly with the adhesions between its fold. Occurrence. Frozen shoulder occurs when the strong connective tissue surrounding the shoulder joint, called the shoulder joint capsule, becomes thick, stiff and inflamed. The joint capsule contains the ligaments that attach the top of the upper arm bone, humeral head, to the shoulder socket, glenoid, firmly holding the joint in place. The condition is called frozen shoulder because the more pain that is felt, the less likely the shoulder will be used. Lack of the use causes the shoulder capsule to thicken and becomes tight, making the shoulder even more difficult to move. It is frozen in its place. Who is at the risk? Age. Adults most commonly between 40 to 60 years. Gender. It is most common in women. Recent shoulder surgery, rotator cuff injury, fractures are the precursors. It is seen more commonly in patients with pre-existing conditions like diabetes, stroke, hyperthyroidism, heart diseases and Parkinson's disease, out of which diabetes is the most common. Symptoms. Its symptoms is divided into 3 stages. First, the freezing stage. In this stage, the shoulder becomes stiff and it's painful to move. The pain slowly increases. It may worsen at night. Inability to move the shoulder increases. This stage lasts for 6 weeks to 9 months. The second stage is known as the frozen stage. In this stage, pain may lessen, but the shoulder remains stiff. This makes it more difficult to complete desirable tasks and daily activities. This stage lasts for 2 to 6 months. The last and the final stage is the thawing stage. In this stage, pain lessens and ability to move the shoulder slowly improves. Full or near full recovery occurs as natural strength and motion returns. The stage lasts 6 months to 2 years. Diagnosis and test. Discuss the symptoms and reviews of the patient. Conduct a physical examination of the patient's arm and shoulders. The doctor will move your shoulder in all directions to check the range of motion and if there is pain felt with movement. In short, passive ROM should be given. The doctor should watch the patient performing his active ROM. Both types of motion are compared. In frozen shoulder, the abduction and the internal rotation of the shoulder is limited. Treatments. Treatment usually involves pain relief methods until the initial phase passes. Some simple treatment includes hot and cold compresses. These help to reduce pain and swelling. Second, medicines that reduce pain and swelling. Non-steroidal anti-inflammatory drugs, that is the NSAIDs, is given. For example, Brufen and Advil. Other painkiller drugs can be prescribed by the doctor. More severe pain and swelling may be managed by steroid injection. A corticosteroid such as cortisone or hydrocortisone is directly injected into the shoulder joint. Physical therapy. Stretching and ROM exercises like pendulum stretch, towel stretch, finger walk, crossbody stretch, outward rotation and inward rotation should be taught to the patient. Transcutaneous electric nerve stimulation, that is the TENS, can also be advised. That reduces pain by blocking the nerve impulses. If simple treatments have not relieved pain and shoulder stiffness after about a year, other procedures may be tried. This includes manipulation under anesthesia. During this surgery, patient will be put to sleep and the doctor will force movement of his shoulder. This will cause the joint capsule to stretch or tear or loosen the tightness. This will lead to an increased ROM. Second, shoulder arthroscopy. The doctor will cut through the tight parts of the joint capsule. This will cause the joint capsule to stretch or tear or loosen the tightness. This will lead to an increased ROM. 3 things you should know if you have frozen shoulder. First, you might get tendonitis. Frozen shoulder tends to pull the rounded head of the humerus further into its socket. The tendons in the arm can become stressed, fusing to compensate for the change, resulting into tendonitis. The condition can be more painful. Second, neck pain occurrence. Day-to-day movements that doesn't cause shoulder pain can lead to a straining neck. Over time, the neck becomes more stiff or painful. Third, hormones matter. Women above 40 to 50 have reported cases of frozen shoulder. Frozen shoulder, as said earlier, is very common in women than men. They have reported cases of frozen shoulder that coincide with the perimenopause or menopause. Prevention. The chance of frozen shoulder can be prevented or at least lessened if the physiotherapy is started shortly after any shoulder injury. Physical therapists can develop an exercise program to meet the specific needs of the patient. Medical experts refer to frozen shoulder as a self-limiting condition, meaning it will eventually go away on its own. However, people with frozen shoulder may or may not regain the full range of motion. If treatment is not carried out, this condition can prolong lifetime. So, that was all my short e-poster on frozen shoulder. This is Angel Bhagat from 3rd year PPT, Physiotherapy College, Vadodara, Sir Sayajirao Gaikwad Hospital. Thank you.